the Elong Microcatheter is my #1 microcatheter that I use up front, because for antegrade cases, it's the perfect balance between the support, trackability, and crossability. For retrograde cases, I do not have any issues or problem to use it inside the septal branch. And once you're in the distal right, for example, you have a very good support. So once you can dilate the septal and cross the septal with it, and once you're on the distal part, you really have the support you need to pursue on the case. So it's my #1 microcatheter. Okay. But I only use the 2.6 French. As I showed in my case, I usually use it. There are different strategies to advance the Expressman. Once you can do like the balloon-assisted tracking, so you can just advance the balloon, advance the Expressman, advance the balloon, so the balloon makes like a rail for the Expressman to follow. Otherwise, you can also do the inch-warming technique, which is like you inflate the balloon in the lesion. You bring the Expressman in contact with the balloon, and once you deflate the balloon, push on the Expressman, and the Expressman just like swallow the balloon and pursue on going further down the lesion. This is the two techniques I use. Also, there is a third one that I use, is that for example, in an Expressman 6 French, I can use a very small balloon, 1.5 millimeter, that I inflate partially on the distal part of the Expressman, so partially inside, partially outside, and it makes like a rail. So I just push it like this, and sometimes it's allowed you to cross a difficult part or a very tortuous part. For the guiding extension for the Expressman, it helps me when I not be able to deliver the device distally or in the lesion. It's really make it easier to deliver the device on the distal part of the lesion, or if it's calcified or whatever. The other thing is that with the Expressman, compared to the other guiding extension catheter, the side hole, it allows you to have a pressure curve, so you can inject really safely, so you can be very distal in the artery and still inject some contrast to guide your PCI. So this is very important to me. I remember a case when there was a severe LV dysfunction with a CT of LAD, and I was very deep inside the LAD, still with the pressure, and the patient was strictly okay. So I think it's important to me. And for the Elong, the fact that I only use one microcatheter during my case, because it allows me to do almost everything except maybe going into small epicardial channel, in which we prefer maybe the 1.9, 1.7. But it allows me to do everything I want, whether from retrograde septal, from antegrade, etc., etc. So